Hi everyone, welcome back to my channel. Today we're going to be talking about epilepsy, types of seizures, diagnosis and treatment for epilepsy. First, what is a seizure? A seizure is a sudden surge of electrical activity in the brain when brain cells stop or excite other brain cells from sending messages. Although there are different types of seizures, they all follow the three-stage format. The first stage of a seizure is called the aura phase. It's when you receive early signs of an upcoming seizure. These signs can come as early as days before a seizure. This stage can affect all senses and also give one the feeling of deja vu. And then the next stage is called the ictal phase, which is the period of time from the beginning to the end of the actual seizure. Common symptoms during a seizure are confusion, sensory issues, and out of body sensations. And then stage 3 is the postictal phase, which is once the seizure ends. This is a recovery period with symptoms being anxiety, frustration, and confusion. And then, although every seizure looks different, it's important to identify when one is occurring. What is epilepsy? Epilepsy is a brain disorder characterized by multiple unprovoked seizures. It's the fourth most common brain disorder in the world, with approximately 50 million worldwide being diagnosed. Not all seizures mean epilepsy, and epilepsy does not cause all seizures. There are many different causes to seizures, some of them being genetic issues or other diseases. Not all of them are because of epilepsy. There are two main different types of seizures, general and focal. General seizures affect both sides of the brain at the same time, and general seizures include both absence and atonic seizures, and these are the types of seizures that you see in movies and TV shows. And then focal seizures begin on one side of the brain, and they can expand to both sides to become a general seizure, but sometimes they don't. And there are two different types of focal seizures with preserved consciousness, which is when the person having the seizure is aware and awake during the seizure. And impaired consciousness is when their awareness is affected during the seizure and they may not be able to recall everything afterwards. Diagnosis for epilepsy. Epilepsy is most commonly diagnosed in people under the age of 2 and over the age of 65. It is possible to get epilepsy at any age, however, it's most common when you're very young or very old. And to get diagnosed, patients have to take neurological exams, EEGs, CAT scans, MRI scans, and CT scans to monitor their brain activity and see if there's any electrical activity that could have led to the seizure, as well as doctors will have to look at their past medical history to see if there's something else that could be causing them. And treatment. As of right now, there's no cure for epilepsy. However, there are forms of treatment to reduce seizures. Seizure medicines have helped over 70% of people with epilepsy. Seizure devices, they send electrical currents through the nervous system and help brain cells go back to their normal state. Surgery, therapies, and clinical trials are other effective forms of treatment for epilepsy. However, there's nothing that will just entirely get rid of it. That's it for epilepsy. If you have any questions, comment them down below. I'll be sure to answer them. Thank you for watching.